In this video, I'm going to be talking about the hypnograms that we see in sleep studies and what is their implication. So hypnogram is a graphical representation of the different sleep stages recorded all through the night. We'll see some examples. It has an x-axis and a y-axis. One shows you the time and the other one, the stages and all the events. It's like a macro level view into the patient's whole night sleep patterns. And depending upon what you record, you can see sleep stages, you can see respiratory events, you can see leg movements, you can see oxygen saturation, body position for the whole night. What all can we see? We can see, like I mentioned, the sleep stages, the stage non-REM, 1, 2, 3. You can see REM, you can see arousals, you can see respiratory movements, you can see cardiac events, oxygen saturation, body position, and if you have used a PAP, you will also see the PAP data. What is the utility? Why is this helpful? By looking at a hypnogram, you can get a snapshot or a macro view about the sleep apnea, if there is a very early sleep onset, if there is a REM onset which is very early, and if there are lots of arousals, a very fragmented sleep. So this will corroborate, or you can correlate this with your history. What about sleep stages? So you can identify the light sleep, which is the N1. Then you can see the N2, and you can see the chunks of N2. You can see N3, what time it came, how many times it came, what were the durations that it came for, when did the dream sleep come, the REM sleep, and the arousals. Let's look at this one, for instance. This is an example of a hypnogram. So this, you can see that these are the sleep stages on the top. The annotations are missing, but I'll show you some more. This is the oxygen saturation. This is the sleep stages, and these vertical lines are the apneic events. So one can really see that there is a lot of apneic events, and this correlates with the oxygen desaturation, and these are the snoring events. So this is what you can see all through the night. This one is with the PAP titration. If you see again, start from here. This is the sleep stages. This is the wake. These dark lines are the REM. This deeper line at the bottom is the stage 3. This is the delta. These are the arousals, the leg movements. On this axis, you will see the data that is recorded. And in this axis, you see the time. And this is the oxygen SpO2 channel through the night. So if we see the beginning part, each of these vertical lines is a apneic event. Let's go through this a little bit more. So you can see that these are all apneic events. Different colors mean that these are red ones for this device are obstructive events, and these are hypopneas. And this I mentioned was the REM sleep. So, and this line here is telling us that this is where the PAP was initiated. So here you see a lot of desaturation, and the PAP has been started. Following this, then some hypopneas appeared, but then there was a good REM sleep, and then there was a good stage 2 sleep, then there was stage 3 sleep, which again and again appeared. But during REM, what we can see that some amount of hypopneas was still persisting. So we will have to remark. And if you look at this, yes, with this, there was also some desaturation. So what does this tell us? That with the PAP, yes, obstructive apneas were less or almost disappeared. There was good amount of REM sleep, good stage 3 sleep, but some hypopneas persisted. So we will have to look at the patient's history and see what else can be offered. And this is for a BiPAP titration that you can see that this is for this. This is the Sorry. Let's remove these and we'll do a fresh one again. So in this, so with this, let's see, this is the steep stages here, and these blue lines are the stage 3, the green ones are the stage 2, then the red ones are the REM. So this is first of all the sleep staging. Then comes this oxygen channel, and we can see that this was showing a lot of obstructive apneas, and this was the initial diagnostic part. Then a CPAP was attempted, and there was still a desaturation persisted, and then there was a BiPAP which markedly improved the situation. So in this way, looking at just this one night, you can get an idea that what was the scenario. What else? So we can look at, this is another hypnogram, and here let us go over this slowly. So again, let us see that this is the stages. So let's say this big paragraph or this big chunk is showing you the sleep stages. And here the dark black lines are the REM. So this is a lot of REM periods initially you see, and you can easily at one glance think that there is a lot of REM. Then you have, these are the respiratory events, and you can see that there are very few respiratory events which are scattered all through, but not really very much. And then this is the SpO2 line, and you can see all through the night it has remained very stable. So in short, and then we say that, so when we look at a hypnogram, it can also tell you that when did the sleep come and when did the REM come. So if I look at this, I can see the sleep came, and this is a 1 hour. So in this, if you divide this, this will easily be, then within 10 minutes, you can see that the sleep has come, and the REM is also come very early. So this should straight away tell you that this is an early onset REM and a very short sleep latency. And this is seen in a condition which is narcolepsy. So one sees this on the hypnogram, you should be able to think that this is something different. And of course, there is no significant sleep disordered breathing. What about this one? Let's see this again. So this is again telling you that these are the sleep stages. And this is the oxygen saturation through, you can see is very consistent. There's not a significant drop. These are the respiratory events. Again, you can see very few respiratory events, not really very significant, all scattered. Some amount of leg movements are here. Then you come to the sleep, and we can see that this part was awake. And again, if you divide this, so this is started at 10 o'clock, this is 11 o'clock, this is 1 hour. So 15, 30, 45, 60. So this is 15 minutes. So you can say that within 15 or 10 minutes, there was sleep onset. But however, the REM came, this red one is the REM, has come much later. So this just means there's a very shortened sleep onset, no significant sleep disordered breathing, but should be commented and remarked upon. So when we look at a hypnogram, you can talk about the sleep onset, you can talk about the REM onset, you can talk about the sleep architecture, you can talk about respiratory events and increased leg movements, significant desaturations. All that is visible by looking at a hypnogram. So by looking at this, you can see with the diagnostic study, you can check about fragmented sleep, frequent apneas, hypopneas. If it is a PAP titration, you will start seeing that the sleep has become much better, apneas have reduced, and oxygen saturation is much better. And for BiPAP, similarly, you can see that this is a much better control of the saturation and the breathing. So the hypnogram, they can help you to diagnose conditions such as sleep, obstructive sleep apnea, insomnia, periodic limb movements, shortened sleep latency, hypersomnia, narcolepsy, and they can guide you for further treatment decisions. And you can also use this to monitor your patients. So, to conclude, the hypnograms give you a comprehensive insight, not only at a macro level, but also at a micro level. It's an excellent snapshot to understand the whole night. We should all be familiar with them, and they will help you to decide and talk to your patients about further methods of treatment. But to correlate the hypnogram with the clinical history and a sleep study report is very important. Like we mentioned, look at the macro level and the micro. How to get familiar? Just while keep on reading the PSGs, every PSG that you see that there will be a hypnogram. So let the eyes get tuned to this. So I do hope that this has been useful for you to understand what is an hypnogram and what is the value for the hypnogram. Thank you for your attention.